Hello, good morning everyone. This is Maria Teresa P. Alata from Bachelor of Science in Nursing Section 1A6, and today I will be conducting Neurological Assessment. Neurological Assessment provides information and evaluates the 5 areas, which is the mental health status of the patient, their cranial nerves, their motor and sensory system, and their reflexes. This kind of assessment is very useful in emergency situation and when frequent assessments are needed during acute physical illness to detect rapid changes in neurologic status. So my patient for today's procedure is my sister, Christine Marie P. Alota. I already got her consent as well as I already got the consent of my mother and father that I will be using her as my patient for today. And as for the procedure, I already instruct her what must be the things that she must do as I perform the procedure. Prior to the conduct of the procedure, we must prepare the necessary equipment of this assessment to conserve time and energy. So hello ma'am, good morning. I am Maria Teresa P. Alota, your student nurse for today, and I am from Southwestern University, Penn. Can I have your wristband, ma'am? Can you state your name?
My name is Christine Marie Alota.
Okay, your birthday please.
December 27, 2006.
Okay. So how do you want me to address you, ma'am?
You can call me Christine.
Okay, Christine, good morning. So explain the procedure to the patient. So right now, I will be conducting a neurological assessment in which I will be getting information about your mental status, your cranial nerves, your motor and sensory system, and as well as your reflexes. So this kind of assessment is will take enough time, and also it requires different or several changes positions, but you don't have to worry since I will give you enough time to rest, okay? And also you don't have to worry since all the information that I will be getting today will be kept confidential and will be handed safely to your doctor. Is that clear?
Yes.
So do you have any question before we proceed?
No.
Okay. Okay, so do you want to void right now?
No.
Okay, that's good. So I will just wash my hands and then I will fix the windows of your room and I will be back, okay? So right after performing hand hygiene, we need to fix the windows for the patient's privacy as well as to adjust the temperature of the room. Then have the patient sit comfortably on the chair or any plane. Okay, ma'am? So sit comfortably, please. Thank you. Then we can now proceed to the actual procedure. So the very first thing that we should do is to assess the mental status and the level of consciousness of the patient. First, observe the level of consciousness of the patient by calling their name and take note of the response of the patient. Christine?
Yes.
Okay, it was nice meeting you.
Nice meeting you.
Okay. So are you feeling comfortable right now?
Yes.
Okay. So the patient or the client is alert and awake with open eyes. Next, observe the posture and the body movements of the patient. So the client appears to be relaxed and her shoulder is erect, which is a good sign. Next, observe the dress, grooming, and the hygiene of the patient. Okay, can I have your hand, ma'am? Okay, so the hands appears neat and trimmed. Also, the skin of the patient is clean. Next, assess or observe the mood or the feelings of the patient. Okay, ma'am, so how are you feeling today, Christine? Are you happy, sad, or angry?
I'm happy.
So, what makes you happy?
I got to finish my modules early and play with my niece while ago.
Okay, that's great. Now we are down to assessing the cognitive abilities of the patient. So we need to assess their orientation, the concentration, the memory, their abstract reasoning, and their judgment. But first, let's start with the orientation. Okay, so right now, ma'am, I'm going to ask some few questions to check your cognitive abilities. So, what is your name? Can you please state your full name?
My name is Christine Marie Paragsa.
So, pila na may edad ni Maroon?
15.
15 years old. Where do you live in right now?
I live in Punta Sulangan, Bantayan, Cebu.
Okay, so is this house your permanent home?
Yes.
Okay. So, can you please state the name of your mother and father?
My mother is Hermenda Paragsa Alota and my father is Mario Ponce Alota.
So, do you have any siblings?
Yes.
So, do you have any siblings?
Balik ka kayong manok?
So, do you have any siblings?
Yes.
So, how many siblings do you have?
5.
5. How many sisters?
5.
So, you don't have a brother?
No.
Okay. So, client is aware of her name, age, her location, and her family members. Now, we need to assess the concentration of the patient. Okay, ma'am, can you please move a little bit here? So, right now, I'm going to assess your concentration. So, here, I have my pen. So, I'm going to place this pen on your right side. And I want you to move this pen on your left side. And grab that pen and give it back to me, okay? Okay, thank you, ma'am. For the client, listens and follow the directions without difficulty. Next, we need to assess the memory of the patient. Okay, so right now, I'm going to assess your memory, Christine. So, what did you eat a while ago?
I eat rice with fish and vegetable salad.
Okay. Okay, when was the last time you go to the beach?
Last Sunday.
Okay, when was the last time you go to cities?
Last year.
Last year. So the patient can recall all the past events in her life. Next, we need to assess the abstract reasoning of the patient. Okay, ma'am, Christine, I'm going to ask you a few questions and I want you to elaborate your answer, okay? Okay, can you please compare and contrast apple and orange?
Apple and orange are fruits. They makes our body healthy and strong. It gives nutrients to our body.
Okay, so what is the difference between the apple and the orange?
The apple has a heart shape and the orange has a round shape. And the apple has a red color and the orange has a orange color.
Okay, so thank you, ma'am. Okay, so right now, ma'am, I'm going to give you a proverb and I want you to explain the proverb, okay? So the proverb is, no man is an island.
It means that a person cannot stand on their own, hence they need assistance from the others to some situation in life. And also that we need to interact and socialize with our peers.
So the patient can differentiate, can distinguish the similarities and difference of an object, and also she can explain the proverb properly. Next, we need to assess the judgment of the patient. Okay, so right now, ma'am, I'm going to ask again some few questions to assess your judgment. So when you feel any pain in your body, what will you do?
I'm going to apply an ointment.
Okay, so if you are bitten by an ant, what will you do right away?
I'm going to scratch that area.
Okay, so if you're in a building and there's a fire, what will you do? Or the first thing that you should do?
I'm going to run and find the exit room.
Okay. The patient answers the question based on rationale. Next, assess the visual, perceptual, and constructional ability of the patient. Okay, so right now, ma'am, here I have a blank page of the bond paper and I want you to write. So there's an object that I want you to write, okay? So here's your pen. Okay, so I want you to write a flower. a normal view. Okay, from this side, I want you to write a picture frame. Okay, that's okay to ma'am. So far, the patient can draw the objects that I've said a while ago fairly well. So the very first cranial nerve that we need to assess is the olfactory nerve, or the cranial nerve 1. This nerve carries impulses from nasal mucous membrane to the brain. Okay, so assess the patient to clear her nose. So can you please clear your nose, ma'am? So after clearing out the mucus on the nose of the patient, have the patient identify the scented objects that you need to, for you to start. Have the patient identify the scented objects for you to start. Have the patient identify the scented objects that you offered. Okay, I want you to occlude your left nostrils. Like that. So close your eyes. Okay. Can you smell it?
It's
Ayun, Nay. Smell lang, smell. Okay. So what is that a while ago?
It's a coffee.
Okay, can you please close your eyes again? Okay.
It's a soap.
Okay, continue putting your nose nostrils. Then this.
It's an alcohol.
Okay, and alcohol. Can you please open your eyes and then occlude your right nostrils? Okay, close your eyes again. So, smell. What is this?
It's an alcohol.
Okay, an alcohol. This.
It's a coffee.
Coffee.
It's a soap.
Okay, so far the olfactory nerve of the patient is intact, since she can distinguish all the scented object that I offered her a while ago. Next, we need to proceed to the cranial nerve 2, which is the optic nerve.
It's a soap. It's a soap.
Okay, this nerve carry visual impulses to the brain. So here, ma'am, I have a Snellen chart, and I want you to read those letters that are above the green line. Okay, go.
E, D, F, C, Z, P.
Okay. So how about those letters that are above the red line?
D, E, F, P, O, T, E, C.
Okay. So far the patient has a 20 by 20 visual acuity. Next, we need to ask the patient to read in newsprint to assist near vision. Okay, so here, ma'am, I have a newsprint, and I want you to read this paragraph.
Fastest trains in this country run between the capital and New York City, but they average only 80 miles per hour. In fact, intercity passengers throughout much of the U.S. must then take a bus, for there is no train or air travel between many cities.
Okay, the client can read the newsprint 14 inches properly. Okay, can I have that, ma'am? So next, assess the patient's retina and optic discs by having the ophthalmoscope to assess the red reflex of the eyes. Okay, next. Next, we need to test the pupillary constriction of the patient's eye. So, right now, ma'am, I'm going to assess your pupillary constriction. So here, I have my pen light. And can you please Right now, I'm going to assess the convergence and accommodation of the pupillary of the patient's eye. So here, ma'am, I have the pen light, and I want you to follow this distant object as I move it on the bridge of your nose, okay? So ready, go. So far, the pupillary constriction of the eyes accommodates and converge to the distant object that I moved. Next, we need to assess the extraocular movements of the eye by having these 6 cardinal fields. So right now, mom, I'm going to assess your extraocular movements of your eye. So here again, I have your pen light. Again, here I have the pen light. So I want you to follow this pen light as I move it around. Okay? So can you please look at this object? Then go. Okay, so far the patients follow those 6 movements that I have performed a while ago without difficulty. Next, assess the 5 trigeminal nerve. Okay, ma'am, I'm going to palpate or assess your trigeminal nerve, or the nerve that is located here in your cheeks and your temporal. Okay? Okay, can you please move a little bit here? Okay. So I want you to clench your teeth. Clench. Okay, clench again. So the temporal and the masseter is contract bilaterally, which is a normal sign. Next, assess the stimuli or the light touch of the patient. So here I have a paper pin. Here I have a paper clip, and I'm going to touch this on the forehead, cheeks, and chin of the patient, and have the patient distinguish if it is a sharp or a dull stimuli. And then right after that, she also need to said where did I scratch the safety pen or the paper clip. So I'm going to touch this on your forehead, cheeks, and chin, and tell me if it is the sharp or the dull side of the paper clip. And also tell me where did I scrape the paper clip. Okay? Okay, can you please close your eyes? Okay, can you please distinguish?
A dull.
So where did I scrape the forehead? Okay.
Sharp.
Sharp. So where? Chin. Another. Okay.
Sharp. Sharp.
Okay, where?
Forehead.
Okay. So far, the trigeminal nerve. So far, the trigeminal nerve of the patient is intact. Next, we need to proceed on assessing the cranial 7, which is the facial nerve. Please smile for me. Can you please make a sad face? Okay. Can you please frown like that? Okay. And then, can you please make a bubble, like pop out your cheeks, pop out? Okay. So the facial nerve of the patient is intact. Next, we need to assess the hearing of the patient, which is the cranial nerve 8. Okay, have the patient sit 2 feet away from you, and you need to whisper some words and have the patient distinguish the word that you whispered. Okay, so right now, ma'am, I'm going to assess your hearing. So can you please move there a little bit far? Okay, side. Can you please cover your left ear? And then I'm going to whisper some words, and you need to distinguish those words, okay? A, B, C, D. So what did I say? Okay, what is the word I said?
A, B, C, D.
Okay, so can you please move there? And then cover your right ear. 1, 2, 3. So what did the words I said?
1, 2, 3.
Okay, so far the cranial nerve 8 of the patient is intact. Next, we need to assess the cranial nerve 9 and the cranial nerve 10, which is the vagus nerve. So, using the tongue depressor, inspect the vulva and the soft palate of the patient. So have the patient say ah.
Ah.
Okay, so please open your mouth as widely as you can. And please spit your tongue? Another spit. Okay, as the patient open her mouth, her vulva and soft palate rise by. So as the patient opens her mouth, her vulva and soft palate rise bilaterally and symmetrically. Next, test the gag reflex of the patient. So right now, ma'am, I'm going to test your gag reflex. So this procedure may be too uncomfortable, so feel free to raise your concern, okay? Can you please open your mouth and relax your tongue? Relax your tongue. Next, we need to test for the cranial nerve 11, which is the spinal accessory. So right now, ma'am, I'm going to test your cranial nerve 11, and I want to shrug your shoulders. And as I shrug your shoulders, I will put enough like force, and you need to resist. Okay? Okay, so okay, the cranial nerve 11 is intact. There is asymmetric and strong contractions of the trapezoid muscle. Right after testing the trapezoid muscle of the patient, we are now going to assess this muscle there on the right and the left cheek. I'm going to put pressure on your, so using my hand, I'm going to put pressure on your cheeks, and you need to push against it, okay? Okay, go. Okay, the other one. So far, the nerve is intact. Next, we need to assess the cranial nerve 12, which is the hypoglossal nerve. Okay, so right now, ma'am, I'm going to assess your cranial nerve 12. So can you please spit your tongue? Like that. Spit your tongue. And then move it. Spit ba? Okay, can you please spit your tongue? And move it on your right, left. Okay. Please bring back. Can you please spit your tongue? Again, so resist the tongue depressor. Ikon ba? Pangusgi ba? Pangusgi. Sige na, 4, 3 to start. Okay. Pangusgi dahil ba?
Ano, kadawak pa mo.
Sakto mo, mo magpapanilaway, bugo. Sige na, 4, 3 to start. Spit your tongue. You can move it to your right. Okay, to your left. So far, the tongue movement is symmetric and smooth. Okay, right now I'm going to test the movement of your neck. Christine, so can you please move your neck on the side? How about this side? And then, can you please chin up as far as you can? And then touch your chin in your chest. Okay, go back to your position. And then, I want you to touch or to tilt your head and touch your shoulder. Yes, and the other one. Okay, so far the neck of the patient moved without difficulty. Okay, right now we need to assess the motor and cerebellar system of the patient. So next, okay, I want you to touch the tip of your nose using your hand like this, and then the other one extend, and then follow vice versa, like that again. Okay. So right now, can you please close your eyes? Okay, so can you please do the same? And a count of 1, 2, 3, go. 2, 3. Okay, so down. Okay, can you please extend your forearm? And then, when I say up, you're going to turn your palms up. When I say down, you're going to turn your palms down, okay? So, up, down, up, down, up, down, up, down, up, down. Okay, thank you. So far, the patient can move her hand without hesitation, and also patient can move her palms up and down without difficulty. And next, we need to assess the sensory system of the patient. First, we need to assess the light touch of the patient. So next, we need to So now we need to assess for the light touch, pain, and temperature sensation. So, okay, right now, ma'am, I'm going to assess your light touch, pain, and temperature sensation. First, let's start with the light touch. Okay, can you please close your eyes? So, is it a light touch? So, the patient can identify light touch without any difficulty. Next, we need to assess for the pain sensation by using a paper clip. So have the patient identify if it is dull or the sharp side. Okay, what is it?
Is it dull?
Okay, how about this?
Sharp?
Okay,
Sharp?
okay,
Dull.
okay. That's great, thank you. Next, we need to identify the temperature sensation of the patient using the hot and the cold test tubes. So can you please close your eyes, ma'am? What is it?
Hot?
Okay. This?
Hot?
Okay. How about this?
Cold? Cold.
Okay, the patient can easily differentiate the hot and the cold as well as the sharp and the dull side of the paper clip. Next, we need to check for the vibratory sensation using a tuning fork. Next, we need to assess for the sensitivity to position. Okay, so right now, ma'am, I'm going to assess your sensitivity to position. So I'm going to lift your fingers up or down, and you need to distinguish if it is up or down, okay? Can you please close your eyes? Close your eyes. Okay, taro nga ba inang ina. Sige, 4. Can you please close your eyes? Okay. So,
Up, down, up, down, left side, right side, up, down, left side, right side, up, down.
client correctly identifies the movement of directions. So right at this moment, I'm going to assess the tactile discrimination of the patient. So let's start with a fine touch. So right now, mom, I'm going to assess your tactile dysfunction. I'm going to assess your tactile discrimination. So I'm going to place an object on your hand and you need to distinguish what is that object, okay? So by doing this, you need to close your eyes. Okay, can you please distinguish what object is that?
It's okay.
Okay, okay, very good. That's great. Okay, another.
It's a paper clip.
Paper clip, that's good. Thank you.
Cotton balls.
Okay, cotton balls.
Spoon.
Spoon, okay.
Clothespin.
Okay, that's great. Thank you so much. You can now open your eyes. So client can identify the objects properly. Next, we need to assess for graphesthesia. I'm going to write some letters or numbers in your hand and you need to identify those, okay?
1 H B 2
Okay.
L 0
Okay, 0.
N.
Okay, so far the patient can identify the numbers and the letters without difficulty. And the last assessment for this examination is the reflexes examination. By doing reflexes, we need to have the reflex hammer or percussion hammer to test the tendon reflex. Okay, so that's it for today, ma'am. So thank you for your time and for your cooperation.
Thank you.
So I am now done with the procedure. So rest assured that all the information that I have gathered a while ago will be kept confidential and will be safely handed to your physician. Okay? So if you need any assistance, feel free to raise your concern right away. Okay? Okay, that's it for today. Thank you so much.
Thank you.
Do not forget to observe proper hand hygiene.